Good afternoon. Thank you, Michelle, for introduction. Thank you for watching us. So first of all, I will talk about how fast COVID spreads in context of kids and schools. It's the application, basically, of what Dr. Vipond and Dr. Lee already said. So kids, the spread in kids, now kids are the group in which the COVID grows the fastest now, from zero in the age group of 0 to 19. The growth rate has doubling time of 14 days. In other groups, it's between 20 and 50 days. So it's by far the fastest one. And also it has the highest case incidence rate. So case incidence rate tells how many new cases we have per 100,000 people in the group. So that's the largest. Also, what is very important, that kids under 12 are 100% not vaccinated, so they don't have any personal shield against infection. And among group kids that are older than 12, 30% are, like 27% are not vaccinated. So also 30% of them don't have personal shield. Next slide, please. And here, what does it mean? Like, whenever people talk about, oh, COVID is not dangerous for kids, they throw at people the small numbers, like, oh, death is only about 0.00048%. But if many kids get infected, those small percentages become really big numbers. And here's the translation of those numbers made by Jeff Kavanagh by using methodology of Professor David Fisman from Ontario. So among our all unvaccinated kids under 12, if COVID has 70% attack rate, if the virus spreads freely among them and 70% of them will get infected, it will translate to 437 hospitalizations. Almost 40 kids will end in ICU, and around 2 will die. And 20 to 60,000 of them will develop a long COVID. But also these calculations were made for previous variants. Data from Ontario showed that Delta is 2.7 times worse in terms of hospitalizations of kids. So we can expect for kids infected, if 70% of kids will get infected with Delta, then 1,200 of them will end up in a hospital. We don't know yet for Canada, we don't have data on critical illness deaths and long COVID with Delta, and I hope we will never have them. So I hope we stop infecting kids with COVID. So next slide, please. This graph shows, it's a timeline, and it shows daily new cases in Alberta over time, starting last summer. And we see that each time we managed to bend the curve, we had in-person schools closed. There's also a lot of saying in Alberta that by public health officials that in Alberta, schools don't contribute strongly to the spread or don't drive the transmission, but we don't have surveillance data. In places where there was surveillance data or more granular analysis done, those places like in Ontario data and Quebec data show that actually schools drive the spread over there, are first. Like in Ontario, first school kids get infected, especially that was true in the second wave, and then the community cases will start appearing. So I don't know why in Alberta it should be different, but anyway, each time we closed the schools, cases started to go down. Also, when we reopened in-person schools and patio dining on May 25th, then the spread rate increased by 20%, both of Delta and origin and previous strains. So there is input from the spread of schools into the overall spread. And what is most important is that, like, each time, so we never managed to bend the curve without closing in-person schools. And today is not the time to experiment, to check, oh, maybe if we don't close in-person schools, this time we bend the curve without it. And also, I'm not aware of any jurisdiction, but maybe it exists, just I'm not aware, that managed to sharply bend the curve without closing in-person schools. Also, schools were closed so we had so many interruptions in schools. Like, we had schools closed because of the virus. We had schools closed in March last year, then in winter, then in spring. Adding to this, many interruptions because of the virus that there were outbreaks and kids had to stay at home again. So basically, if we have the virus, we cannot have normal schools. We really need, if we want to have functional in-person schooling and normal uninterrupted education for our children, we need to eliminate the virus from our community. There's no other way. Next slide, please. And it's possible to eliminate virus. New Zealand just some days ago managed to bend the curve, Delta, and they have rapid decline, halving every 6 to 9 days. And they have only less than 30, when they bend the curve, less than 30% people were fully vaccinated in New Zealand. So we are able, if we do the same as they did, we are able to reduce the spread. And even if we would go full lockdown like New Zealand, we could do it faster than them. So basically, in less than 7 weeks, we could eliminate the virus in Alberta. If we go a little bit slower, so we will have our regular shutdown, we can eliminate virus in Alberta in mid-December, early January. So basically, it's possible. And if we do it, we can have uninterrupted education going forward. If we want to do it, probably we will have 5th wave, 6th wave, and we have this conversation about schools again and again and again. So thank you very much.